ketamine is probably the biggest breakthrough in the treatment of mental illness we've had in the last 40 years, because it's a legal medicine that works in people who've not responded to previous treatments, and it works in a very different way in the brain. So it's actually a revolution. The problem with ketamine is that, of course, it's been around for a long time. That has a great advantage, it's very safe, but on the other hand, it's also got some bad press. And there are examples of people using it recreationally. And so it's a controlled drug. And that makes it more challenging for doctors to prescribe and to use. I don't think that's too difficult. For most doctors, it's pretty straightforward. But the stigma against ketamine has actually held back its being rolled out as it should be. But now I think there's just so much clinical data, there are so many trials and so many expert groups using it, that I think we can reassure patients and doctors that it is both very effective and very safe. I don't think there's any doubt that ketamine therapy, and hopefully in the future, other psychedelics which will also come into the clinic of change, but at present, ketamine is the only one we've got. It changes people's lives. It gets them out of depression, it gets them out of addiction, it gets them out of eating disorders in a way that other treatments don't. So the big difference is this: other treatments are like a sticking plaster. You put them over the wound, but the wound doesn't heal, whereas ketamine disrupts the process that is making the wound in the first place. It heals the brain, and so the brain's in a position to stay well for as long as necessary afterwards. A really important benefit of ketamine is that it works very quickly. The effect is maximal a day later. And that is remarkable. No other treatment for depression works in a day. So that has the ability to keep people out of hospital, get them out of hospital, and get them away from those deep depressive thoughts which increase the risk of things like suicide. So no, it is a revolution in mechanism and in speed of onset. Well, I think it's very exciting for people in Portugal to have access now to this new therapy. And the great thing is it's going to be done in a structured way that has got proven outcome measures. And in Portugal, you'll be collecting the same data as we collect in England. And so over the next few years, we'll build up a great body of knowledge on how best to use it and how effective it is, and which people are the target population, what are the issues we might have to deal with. We will together become experts in the use of ketamine.